not always available. Nice to see people landing in the room. Very warm welcome. We just wait a minute or two as others come in. So, a hugely warm welcome to you if this is the first time you've ever been to this conversation, and equally warm welcome if you're a returner. This is a series of conversations about shame in healthcare, where we're exploring issues around shame with the intention of understanding better what we can each do to mitigate its negative impacts and to start positive discussion to enable ourselves to navigate it. So, really looking forward to hearing from Clive, who will introduce shortly, and to having an opportunity to have a little bit of a discussion in some breakout rooms later. So I'm going to hand over now to Luna, Professor Luna Dolezal, who's here, who is going to introduce Clive.
Hello, everyone. Sorry, I realized my name says the Shame Lab. I'm using the Shame Lab's Zoom account, but I'm Luna Dolezal, based at the University of Exeter, and I was the PI of the Shame in Medicine project, and I'm co-director of the Shame Lab, which is kind of hosting this initiative of having these seminar series, along with Susie and Sandy, who are in the call, and Penelope and Will, who aren't here today. So I'm really pleased to have Clive with us today. Clive's going to speak for about 10 to 15 minutes on shame, motivation, and veterinary medicine, and a very brief bio for Clive, and he'll tell you more about himself. But he has practiced as a specialist in private practice for 20 years, and from 2010 to 2019 was managing director of a large veterinary referral practice where he developed his interest in and experience of professional leadership. Clive now concentrates his time on executive coaching, leadership development, and strategy. So this is going to be a really, I think, really cool and different perspective on shame in healthcare, and we're really looking forward to hearing your talk, Clive.
Great. Thanks, everybody. Hello. Lovely to be here. Firstly, thank you to Luna and the steering group for the invitation and opportunity to present. This is going to be a personal perspective, and it's offered as a substrate for reflection. And it's a historical narrative overlaid with some recent sense making. As such, my recollections may be distorted by time and are inherently unreliable, but we'll do our best. My story also contains a reference to a suicide attempt, so please do not feel you have to stay if this is uncomfortable at all for you. Whilst there's reference to pain, however, it's important to make it clear that my narrative is interwoven with much joy and gratitude. So it's not all doom and gloom. I graduated as a veterinary surgeon from Cambridge University in 1989. I also have a master's in immunology, a PhD in canine gastrointestinal disease. I qualified and practiced as a specialist in small animal medicine for over 25 years and led a 50-vet multidisciplinary practice for 10 years. In 2021, I gained a master's in executive coaching. As an example of the somewhat absurd drive in my professional career, in 1995, whilst my wife was caring for our 9-month-old son, I sat my finals for my master's in immunology, then 3 weeks later travelled to Disney World to sit American board certifying exams, all while ostensibly undertaking PhD research. If you are familiar with McClelland's 3 needs theory, I think it's fair to say I had a very high need for achievement. Where did that drive come from? I began to answer that question when studying for my coaching masters, and much of this presentation is derived from that work. When coaching, ineffectively, I felt a fellow student, I experienced an episode of what I now know to be acute or uncontained shame, with subsequent self-recrimination and rumination. Fortunately, the environment and emotional literacy created by the coaching course allowed me to name and explore it. I recognised feelings which reminded me of episodes in my past, such as when, at the age of 14, I was being shamed by the maths teacher at my new school because I was unfamiliar with the new maths course. That awful, gut-wrenching, breathless, voiceless, trembling, heart-racing feeling was accompanied by a desire to hide and prolonged rumination, wishing I had responded differently in class. It was no coincidence, I feel, that this experience, accompanied by loneliness, a sense of inadequacy, lack of pastoral support or friendships, led me to a point of despair where I swallowed a whole bottle of aspirin. Fear, confession to my parents, and a trip to the hospital for a stomach pump followed, as did emotional suppression and a determination never to feel that way again. When making sense of these experiences, I drew a direct line to my motivation and drive to achieve. Academic and career achievements would keep the spotlight of criticism off me and my shame contained. I gradually settled into school, and acceptance through academic and sporting achievements followed. Being told I was probably not good enough to get into vet school was an effective way to get me to work hard, and I was successful in that, an achievement which kept shame contained for a good few years. When I qualified in 1989, I was already determined to become a specialist and embarked on a long course of learning and examinations, building my shame defences so I could say to myself and others, if I do not know, no one does. Some self-sustaining hubris there. No achievement, however, succeeded in easing the aching drive to be better. And there were, of course, costs. Relationships, both romantic and friendly, suffered. My self-care was poor, with a less than healthy use of alcohol, especially in social situations. I did not live well. The catalyst for change was when I moved into a leadership position and began to explore myself as a leader. The Coaching Masters was a whole new challenge, which introduced me to concepts and ways of being that were completely different from my scientific, evidence-based clinical learning, and all the better for it. I learned to lower my defenses, listen to what my emotions and my embodied senses were telling me, and open up to deeper relational work. As well as practicing mindfulness, I was able to share my experiences with my student group, who did not care that I was a veterinary surgeon, but did care for and about me. Through this, I achieved some healing and a healthier relationship with shame. Where am I now? I remain curious. I enjoy writing and thinking in communion with others, and I'm on the slow road to full retirement. I still recognise feelings of shame, but accept them as normal and healthy. I certainly do not feel the need to sit any more exams. Now I'm going to share with you some models which I created to draw some of these thoughts together. So give me a sec and I'll just get my slides up. So this shows my sense of where I started. I'm not here to criticize my parents, but my parents aren't the most emotionally open people. I didn't have a great emotional literacy growing up, and I certainly had, for whatever reason, high shame sensitivity, low self-esteem. Events such as the event in the maths class that I talked about certainly were shameful and led to despair. And because I didn't have much in the way of support, that led to the suicide attempt, which was also shameful, and created development of coping mechanisms which were self-reliance, intellectualization, emotional repression, a degree of social withdrawal, and this drive to high achievement, which wasn't always successful. And when I failed, that might be accompanied by humiliated fury, and which in itself was shameful because emotions were sanctioned in my household. and self-criticism and criticism of others drove the shame spiral downwards, so it became more and more apart. But professionally, of course, very successful. I developed into an expert professional with a heavily defended ego, but I was lacking in some areas, I think it's fair to say. Leadership challenges, questioning my responses, self-examination, and some exposure to leadership development, harnessed my natural curiosity, increased my awareness. I was able to face into some of the accompanying discomfort that was helped by the experience of being coached. That meant my defenses could lower. I could begin to make some meaning and see some opportunity, and wanted to develop as a coach, which in itself, I was not anticipating this, of course. This was all before I noticed and recognized my shame. But I was then able to do that, and through the support and kindness of others and development of self-kindness, I was able to get into a virtuous circle of reducing shame sensitivity and reducing shame, and feeling like I had come to much greater terms of what shame was and how it had pushed me and my career and my drive in the past. It's sort of where we are now, really. So that was just models for me, and it helped me make sense of where we are. The fuller thinking from this is in a chapter in this book, Introduction to Veterinary Humanities, which was published this year. It's a wonderful, eclectic, enriching collection of essays and thoughts from a wide range of people. It's a really great read. And I'm going to take from that a poem which I'm going to conclude with, which I found really spoke to me and to my journey with shame. And this is by the poet Khalil Gibran, and it's On Clothes. And the weaver said, "Speak to us of clothes." And he answered, "Your clothes conceal much of your beauty, yet they hide not the unbeautiful. And though you seek in garments the freedom of privacy, you may find in them a harness and a chain. Would that you could meet the sun and the wind with more of your skin and less of your raiment. For the breath of life is in the sunlight, and the hand of life is in the wind. Some of you say, it is the north wind who has woven the clothes we wear. And I say, aye, it was the north wind, but shame was his loom, and the softening of the sinews was his thread. And when his work was done, he laughed in the forest. Forget not that modesty is for a shield against the eye of the unclean. And when the unclean shall be no more, what were modesty but a fetter and a fouling of the mind? And forget not that the earth delights to feel your bare feet, and the winds long to play with your hair. Thank you.
Thank you, Clive. Thank you for that really reflective and really personal account. I think everyone appreciates that, and yeah, thank you very much. It's really lovely to hear your story and to see a model for how to come out of these destructive patterns of shame and shame sensitivity. So we have, thank you, Susie, for posting those in the chat. We have 3 questions that might prompt discussion in our breakout room discussions, and they're up on the slide and also in the chat now. And I think Susie's going to put everyone into a little smaller discussion if you'd like to